So starting with the IV insertion, I'm going to gather my supplies. I have the IV start kit. I have the IV extension set, my needle, 22 gauge, and my normal saline flush. I also have my tape, and I'm going to prepare the 3 1-inch strip tapes now. I'm going to cut the first strip in half. And I'm just going to get one more strip to make it 3. After that, I'm going to go and perform hand hygiene. And perform IPI. Hi, my name's Gabriel. I'm going to be your nurse today. Let me go ahead and just give us some privacy. Can you please identify your name and date of birth for me, please? Okay, so what we're doing today is a IV insertion. That's just to give you your meds, or just the doctor ordered an IV, so we're just going to go ahead and do that today, okay? So what I'm going to do now is I'm going to start setting up my supplies. I'm going to prepare my supplies for use. I have my Tegaderm here. I'm going to put that to the side for now. I have my alcohol swabs, my tourniquet. I'm going to go ahead and get that ready for use. And I also have my extension tubing, which I'm going to prepare now with the normal saline flush. And I'm going to take the cap off of the normal saline flush. And I want to get rid of the air to not infiltrate the patient. And I'm going to go ahead and put the cap back on for now. I'm going to take the tip off of this catheter extension and apply it to the flush. And what I'm going to do now is I'm going to prime the line, or flush the line to prime it. Looks good. So to maintain sterility, I'm going to keep this into the package. I'm also going to get my needle ready for use. And I'm just going to loosen it up so it would be ready for when I'm ready for insertion. After that, I'm going to apply my non-sterile gloves. And I'm going to ask the patient which hand is dominant. The patient says that his left hand is dominant, so I'm going to use his right hand. I'm also going to look for any contraindications, such as an AV graft. After that, I'm going to look at the site that I want to use, and if it's hairy, I'm going to remove any hair that I need to access the vein. After that, I'm going to apply the tourniquet to the arm. At this point, I would put a towel underneath the patient, but since I was limited with space, I did so already by putting this chuck underneath the patient. So now after applying the tourniquet to the arm, I'm going to ask the patient to hang the arm below the bed or on the side of the bed and clench his fist for the blood to flow downward and make the vein nice and engorged for me to start the IV access. After doing so, I'm going to clean the site and find the vein that I want to use. After finding the vein, I want to clean the site for about 10 to 15 seconds. And now I'm ready to start the needle insertion. First, I'm going to inspect the catheter for any flaws. And the needle looks fine. I'm going to make sure that the bevel's up. And before I go in, I'm going to tell the patient to take slow, deep breaths. And I'm going to go ahead and find the vein and insert my needle. After inserting the needle, once I see my flash of blood, I'm going to remove the tourniquet. And I'm going to advance the tip of the catheter. I'm going to make sure that this, I'm also going to make sure that this needle locks for my safety and dispose of it in the sharps. After the catheter, the catheter tip is in, I'm going to make sure to hold it as blood might be flashing out. I'm going to grab my extension tubing and connect it to the tip. So what I want to do now is I want to flush the line and make sure that the patient, there's no swelling coming from the line, or that the patient doesn't complain of any burning. After doing so, I'm going to clamp the tubing, or clamp it. And after clamping, I'm going to go ahead and discard of the flush. I'm sorry, I'm not going to discard of the flush. I'm going to tape down the line first so I can have more access. After taping it down, now I can remove the saline, and I'm going to go ahead and tape it down more with one underneath the extension tubing. And I'm going to go ahead and tape it in a cross-like motion. And then the last tape, I'm going to tape the extension tube to the arm. Once that's done, I'm going to remove my gloves and clean the area. And after cleaning the area, just removing any blood in the site, I'm going to initial, time, and date my tegaderm. And the time is 9:50. And I'm going to go ahead and put that over the site. After that, I'm going to put the patient's call light in reach, let him know that the procedure is done, and if he has any questions or comments, to let me know, and that will be with him shortly.